A new report suggests Google has been secretly collecting the personal health records of millions of Americans. According to the Wall Street Journal, the effort is codenamed Project Nightingale. It reportedly involves a deal made last year with Ascension, a leading nonprofit health system, which includes more than 2,600 facilities in 21 states. Patients and doctors were not notified. Our Dr. Tara Narula is here. Tara, good morning. What are the concerns here? Are there violations? Is it legal?
Good morning, Tony. So Ascension says the work it's doing with Google is compliant with HIPAA, the federal patient privacy law. The companies say the goal of this data collection is to provide better care to patients. Since it's just getting reported now, the program is creating major privacy concerns.
The multi-billion-dollar healthcare industry has long been on the radar for tech behemoth Google, and now it's in it in a big way. As first reported in the Wall Street Journal, Ascension is sharing information with Google, a health system that includes over 2,600 hospitals and healthcare centers in 21 states. In the program called Project Nightingale, Ascension is reportedly providing patient names and dates of birth, as well as lab results, hospitalizations, and diagnoses to Google. Google is using the information, in part, to help Ascension centralize its patient database, as well as design new software that will use artificial intelligence to predict or identify medical conditions.
There are huge advantages to digital health information.
Pam Dixon is with the World Privacy Forum and says digital records are necessary. So is knowing exactly what companies are doing with such personal and private information and how they are protecting it.
Leaks of private medical information are enormously common. The Department of Health and Human Services actually tracks all of the medical data breaches, and actually some of the largest data breaches in history have been medical data breaches, so it is a significant concern.
In a press release, Google and Ascension say they are fully committed to a robust data security and protection effort and fully compliant with HIPAA, the Health Insurance Portability Act of 1996 that protects patient privacy. Dixon says more has to be done.
But I do think that there is room for having an independent third party taking a look at what's happening at that health information that's at Google.
While Amazon and Apple are also trying to get a foothold in healthcare, Google has made the biggest strides so far. It has a previous deal with the Mayo Clinic, but in that case, any identifying information had been removed. Not so with Project Nightingale.
You got me with the term lab results are being shared. So how concerned should patients be that this information is being shared in this way?
I think it's a very difficult conundrum we find ourselves in. On the one hand, you can see the value of streamlining information, potentially being able to better diagnose patients, to predict things that might happen. On the other hand, there are certainly risks. And, you know, that doctor-patient relationship is one built on trust. It's a very secure, safe environment. You know, patients tell us things in the office that they don't tell anybody. Anybody.
Right.
Things about their spirituality, about their social habits. And so to risk that being leaked in some way at some point is very scary for a lot of
Patients
patients.
or doctors, neither one of them were told. It makes you wonder, why not solicit feedback ahead of time and say, hey, just so you know, we're going to be sharing. It's going to be great.
I think it would have been a lot easier to buy in if you agreed and said, yes, I'm giving my information, but to not know and then have it out there, it's concerning.
Yeah. All right, Tara.
Sounds like they got to come up with a way to change the system. It's very disconcerting to know that
Yes.
I go in the privacy of your office.
Yep.
Anything that's shared, to know that it could be leaked anywhere.
That's right. And it may make patients not want to share as much,
Yes.
which is the wrong thing.
Yeah, how are you feeling? I'm fine.
Right.
Yes.
Right.
All is well. Be sure to tell my
Exactly.
insurer
Don't
everything
want
is
this
great.
out there. Yeah.
Right. Nothing to see here.
All right, Tara. Thank you very much.